Guys, let's have it quickly. I'll be talking about the pathology of what Klinefelter syndrome. Alright, so I remember the good old days when we were talking about Klinefelter, when we were still doing all those embryology and the rest. Okay, that was just some mild knowledge. Okay, so now we're about pathology of diseases. Basically trying to look at what causes diseases, right? Now, even if a disease is being caused, how does it progress? Okay, so on that we'll be looking at what Klinefelter in that scenario. I'll be looking at what the pathology of Klinefelter syndrome. Okay, so in an exam, students were asked what write short notes on the pathology of what Klinefelter syndrome. Klinefelter syndrome. In embryology classes, we knew that Klinefelter syndrome was basically what 47XXY, but here you guys you get to see variations, right? So that's how knowledge adds when we go up. So Klinefelter syndrome is mostly occurring in males, and some of the features include less body and facial hairs, gynecomastia, that's enlarged breast, a broad hip, and testicular atrophy. Right, so let's go and talk about the pathology of this disease condition. We said that this is the male hypogonadism, okay, that occurs when there are two or more X chromosomes, all right, two or more X chromosomes or one or more Y chromosomes. You should take note of that definition, all right. So the incidence in about what 1 in 660 what live births, okay. So 90% of these cases have a classical pattern with the karyotype what 47XXY. Okay, but okay, this occurs from non-disjunction during the first meiotic division in one of the parents. Okay, so about 15% occurs as what mosaic patterns. Okay, with 46SY and 47XXY karyotype. Okay, so you can see this. You see gynecomastia, several clinical presentations, right? So I have the clinical features here. All right, so we'll talk about them. We'll go back to that image. So male infertility. Why would there be male infertility? This is because there's what testicular what atrophy. Your testis has basically disappearing away. Your testis house the sperms, right? So there'll be what infertility. There's increased length between the soles and the pubic bone. This just means what? Disproportionate arms and legs or long arms and legs. So between the soles of the feet and the pubic bone, you have a very wide range. You understand? The atrophic testis, I've already spoken about that. That is what is causing what? Infertility. An absence of male secondary sexual characteristics, like let me say bed and all that. So there's poor bed development or poor bed growth, okay? So female type pubic hair pattern. Female pattern of what? Fat distribution. Many things are kind of like looking like females because of the presence of an extra X chromosome there, right? So there's gynecomastia. Gynecomastia is basically what? Enlargement in the breast in males. There's a high follicle stimulating hormone levels and there's low testosterone hormone levels. Okay, so that's it about what pathology of what Klinefelter syndrome, also known as what male hypogonadism. Okay, so that's it now, and see you guys pretty soon.